Karibu and welcome back to Parliament.
Thank you.
And we thank God for you.
Thank you, Madam Speaker. I want to say thank you for welcoming me. I want to thank all the MPs in this House, those who came to the hospital in Nairobi, those who came to Dubai, those who came to United States of America to see me. I want to say thank you, thank you, thank you. Because when you are in this post and somebody comes to see you, it really means a lot. It really means a lot. And it's not that I wanted to be sick or I wanted to go down, but some way, somehow, I got sick. So I really, really want to thank the Speaker, first of all, for really allowing me, even in this time that I was away, that he will stand with me. But the person who stood with me and really stood out better is the clerk of the National Assembly. The clerk of the National Assembly went above and beyond to really make sure that I was okay. He came to the hospital here, in Nairobi Hospital. He came he sent people to Dubai. And every time there was a member who visited United States, he made sure that he came to see me. And I want to say thank you, thank you, thank you. Even when I arrived, he made sure that I was okay, everything was working well, and I want to thank him from the bottom of my heart. The next person who really stood and really, really helped me out is my wife. She was there from the beginning to the end. She's still there, and I want to say thank you, and thank you, and thank you. And I want to say also thank you for people of Mosop, because they understood that I was sick. And it is not that I wanted to be sick, but they understood that I was in this post. I've been gone now for 15 months, but somehow, the projects were going on. Those in the office were able to make sure that they followed the procedure and things was done and everything was going on well. But they were patient with me. And I want to thank the majority leader, Kimani Ichung'wah, for making sure that I was able to vote, I was able to participate in online voting, I was able to be welcomed back in style, and he was able also to make sure that I'm comfortable as I was sick, and now I am back to the House. I want to say thank you, thank you, thank you. And as a member, I want to mention something about healthcare. I am so happy that the president was able to just give the state of the nation. I know he has given before, and he gave a few days ago. I want to support his speech. He was very, 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 very straightforward. He's a very ambitious person. He talked about the roads that he is going to do some dual carriaging. For every nation to succeed and to move from that world to a first world, we have to have roads. We have to have experiences. We have to have roads that open up to cities, to centers, and even to the rest of the country. And so for the president to really want to do a dual carriage in most of the country, I want to just commend him and to say thank you, thank you, thank you. Another thing that this president has done is to make sure healthcare is done right. Healthcare is done right. That is why I was even sick. When I went to Nairobi Hospital, of course, my wife knew that I had a stroke. We even asked the doctor to really give me the medicine called a TPA, which would have stopped the heart attack at its roots. But some way, somehow, the doctor said, no, Mheshimiwa will be okay, and he will go home. Dr. Caro came, told the doctor the same, can you give him a TPA so that Mheshimiwa can be okay? The doctors at Nairobi refused to give me the medicine. At 2 o'clock, they told me I can go home. My wife told them, okay, before you go home, can we even do the checkup of his blood? It's when they did the blood work, and they gave me the paperwork, and they told me to go home. On my way home, before we went home, my wife asked them, did you read exactly what the paper says? And then she said, let me take to the doctor. When the doctor saw, they were now running everywhere to make sure that I get a bed. So I was there for 18 days. My heart was going down and down. When I was admitted at Nairobi Hospital, I was at 25% ejection fraction. It went down to 22, it went down to 20, it went down to 18, and it went to below 18%. In a week's time, I was going to die. But some way, somehow, God saw it that I went to Dubai Hospital, and they told me, and this is something that I want to say. I know that it's very controversial. The Poisons and Control Board, I really want them to look at the medicine of this country. They told me to make sure that I leave all the medicine that I was given in Kenya, and they were going to give me their medicine. They gave me exactly the same medicine that I was given in Nairobi. But some way, somehow, my heart now started going up from below 18% to 20, from 20 to 22, from 22 to 20 to 30, and I was now stable and ready to go. And I asked the doctor, why is it that the medicine that you gave me was able to work, but I was going to die in a week in Nairobi? They told me, you need to look at the medication that you have in Kenya. Most of the medication, they have a problem. And I'm asking the Poisons Control Board, because if they can actually give me the medicine that was not working, so many people who have been taken to that hospital have died. Because they tell you that, of course, their service is okay. They bring you tea, they bring you whatever, but their medicine, I want to ask the government and the Poison Control Board to look at it. Because if it's the same medicine, I would have gotten better here in Nairobi. But some way, somehow, the pharmacy and the Poison Control Board needs to be checked and needs to be checked right. So I want to say thank you, and I want to ask to invest a lot of money in healthcare, because a healthy nation is a nation which is productive. It is so productive. And I'm asking the president to continue what he's doing in the healthcare. SHA is working. I want to tell you, SHA is working. Wait until you are sick, and then you will realize that really SHA is working. So many people in my constituency, they go to the hospital and they get treated because of SHA. So I want to ask the Kenyans to make sure they enroll in SHA. But I want to ask the doctors also to be held accountable. Because if you go to the hospital and you tell the doctor, can you really check me out, what is the problem? They tell you it is malaria. They tell you you are sick for this or you are sick. But before they check you, they look at you and they decide you have this disease. I really want to ask that there must be a board that is holding them liable so that you can ask the questions the doctor. Otherwise, they will continue, and so many of our sisters and brothers and our parents are going to die. With that, I want to say thank you, thank you, thank you, and may God bless you so much. Thank you so much. Thank you.